As we continue to fight the coronavirus, we still need to take care of your hearts, your minds, and your families. And that's what Health Check is here for. Today's conversation is on postpartum depression. And I absolutely love what is on our Facebook page, if you haven't checked it out. It says that there is a complex mix of physical, emotional, and behavioral challenges and changes that happen to our women after giving birth, a form of major depression. And today, that's a conversation we're having with Dr. Wachira Murage, Obstetrician-Gynecologist, and Margaret Mbuthia, a Clinical Psychologist, as we continue. And we had a case study as we started the show, and one of the things that had been listed was a word that I cannot pronounce. Could you say it one more time and explain why that could be a cause? Because many are asking about it.
We mentioned the lady in the clip had placenta previa.
Yes.
And placenta previa is when you have the placenta low-lying. It's ahead of the baby on the lower aspect. The placenta ideally should be up and the baby should be down. And it poses a risk when it is on the lower part of the uterus, ahead of the baby, because it can bleed.
Wow.
So what must have happened in the lady in the clip is a lot of stress throughout the pregnancy, because what happens is that if the placenta starts to bleed, the cervix opens, then they lose the baby. So you can imagine for all that time she had the placenta previa, there was great worry. She was worried. And difficult pregnancies is one trigger to postpartum depression. They are so worried, they don't even know whether they'll get to term, to deliver. And most of the time you deliver the babies early. So there's the worry of going to nursery. Yeah, the survival of the baby. You need to go to newborn unit. How are they going to survive? There's also the financial bit, because once now you're going to an operation, because most of the deliveries for placenta previa are cesarean section, the baby goes to nursery. There's enormous spending, and the hospital bills are huge. So those combination of worries in that mother would have triggered her to postpartum depression.
Absolutely. And Margaret, could you share with us also some of the experiences you've had with the symptoms as well, just for someone who's just joined us, even as we try to catch them up and get them to speed with postpartum depression?
If we are to recap again, like we looked at the three and we said the baby blues, the postpartum psychosis and the postpartum depression. And the most severe of them all is the postpartum psychosis, because of the emergency that comes with it, and the way it just leaves the mother totally not in a position to take care of the baby. It's very disabling, if we can use that word. Because even the mother cannot manage herself, let alone take care of the baby. And with the psychosis, then what this means is that because the baby is taken away, like Dr. said, when the mother is admitted, maybe because they have the hallucinations, or maybe they have the delusions, the suicidal ideation is real, and the mother is a threat, and a danger to the baby, to herself, and to other people. Extremely low mood, very, very low mood. They are not taking care of themselves, so generally they are unkept. They've lost interest, they are not talking, or they have a very elated mood that is, totally out of the norm. And one of the effects that you will see with the postpartum depression, and whether the psychosis or the depression, is that because the mother is not emotionally stable, then they emotionally do not connect with their babies. And so there are issues of attachment, and they don't bond. And when children are not emotionally attached or securely attached, remember the mother is the primary caregiver in this instance. The baby is 100% dependent on a primary caregiver, the mother, for feeding, for bathing, for changing, for everything. So when the child doesn't get the attention that the child needs, they grow to be very insecure children. that children ideally is when I cry, someone responds to my cry. When I cry because I need a diaper change, someone responds to that. And when they get that, they are fulfilled. And then they learn to know that anytime I cry for a change of diapers, then I get it. If I cry because I've just been lying in bed for too long, someone comes to me and just soothes me and calms me down. And that child grows to be secure. And those are the kind of children we have who are confident children, and later in adult life, confident adults that we have. So when the child does not get this at that very early stage, they grow to be children who are extremely insecure, low sense of self-esteem. And because they are not even breastfeeding well, then that basically means their nutritional needs are not being met. So they are more sickly, and maybe sometimes not even organic. They're not sick organically, they are more psychosomatics. You know, the haba. And they grow up to sometimes be very difficult children, and even children with conduct disorders and other forms of behavioral challenges.
Okay.
And those are just some of the impacts. So when you're looking for the symptoms, to come back to answer your question,
Yes, please.
the low mood, the change in eating and sleeping patterns, it's very, very key. The loss of interest by the mother to take care of the baby, to nurse the baby, will be crying, and the mother is just not responsive at all. Watch out for suicidal ideation, watch out for just a general change in behavior that is out of the norm of what you expect of a new mother.
Okay.
Yeah.
Doctor, you'll be telling us the impact as well, so that we can have each and every person that's tuned in take this very seriously on the impact of the child. But as you do that, our call line is officially open. You can call in to ask any questions you might have. The number is on our screen, and even as you do that, you can text in on 22232. Do not be shy. This is something that we're talking about. We're open, and if you're going through this or afraid someone around you is going through this, we are here for you now, and you can get to do much more about it. Dr. Why is it very important for parents, for family to get treatment for this?
Very, very key. Just to add to what Margaret has said about the mothers, they also tend to cry without any good reason. It's also quite a major sign from
the mothers. I cry all the time. It's okay.
Those ones you'll cry. Maybe you cry for other reasons.
When I'm watching a movie, Jesus, the Passion of Christ. Anyway.
Yeah, so they also tend to cry. But Margaret has told us very clearly what happens, especially on the development of the child. But on the immediate, there's also failure to thrive in those babies. There's failure to thrive. They don't grow well. The milestones, the developmental milestones, are normally really affected when you have mothers with this kind of problems, the psychosis and especially the depression as well.
Yes.
It is very important for us as husbands, as family and close relatives to really take care of these mothers, because when the mother is not happy, the baby is not happy. Then we have issues and big issues. We have now like sort of two patients. We have the baby who is not growing well. They might have marasmus, kwashiorkor, diarrheal diseases. They are always in and out of hospital. Then you have the mother who is not taking care of the baby, and also looking at the long term. Yeah, because if we do not take care of postpartum depression, what are we saying? You've just been told there is suicidal tendencies. Suppose that gets to happen. What will happen? There will be lots of problems. If we do not take care of this mother, and then finally they end up in major depressive illnesses, what are we talking about? We are talking of absent mother, because they have to go to rehab, they have to be admitted. Yeah, they also a risk in the family. Remember, they can also be violent in some instances. And they are not taken good care of. So the impact is huge, and there are all the reasons for us as family, as caregivers, and the whole support system to take care of these mothers.
Absolutely. A text on 22232. We take this with utmost confidence. One texting in and saying, could someone have postpartum depression after an abortion? They add to say that it's been 7 years and I've never healed from the same.
I don't know whether to call it postpartum depression, but I would look at it as complicated grief. Yes. Because what they're dealing with more is the loss of a pregnancy. And what they didn't process was the loss. And so when you grieve for too long, then it is complicated grief. It's really not more of a postpartum, but more of a complicated grief, especially because it's been 7 years. Because if it was postpartum, then the symptoms we are talking about, and by this time the 7th year, then the symptom severity would be really, really heavy. Yes.
What would you say to that person? Because they're tuned in this time, and any support.
It's the perfect time for them to go and seek counseling, right? The perfect time, because then if you're dealing with complicated grief and you're not doing anything towards resolving it, it's this cloud over your head. It becomes like a shadow. So wherever you go, it follows you. And you know, grief is makes you have this hollowness inside of you. And so because on the inside you're feeling completely empty, then your outward and outlook towards what is happening on the outside is influenced by what is happening internally. So they are constantly in this state of mourning and grieving, and so they will never experience, happiness and live a normal day like before they went through the abortion. So you need to resolve that, deal with the circumstances surrounding the termination, deal with the consequences of the termination, and then just come to terms with it, and then you feel lighter.
Okay.
Yeah.
And we wish you well as you resolve that. Don't just sit back. This is a good time for you to get help, even though it's through telemedicine and any other way that you can. But a highlight is that Jesus has forgiven you and he loves you so much. For you, what comment would you give to?
Yes, thank you. Two things. Number one, we normally, when you have miscarriages and abortions, it's taken very lightly. Everybody thinks, it's a small pregnancy, so it's gone, and it is another opportunity to get pregnant. But it's not like that. It normally has a heavy toll, especially on the mother who has lost the pregnancy. And in reproductive health care, we have a package, a post-abortion care package, and counseling is one of the prominent factors in that package, and they should not forget to undergo counseling, because it's very, very key. They may think they are very strong, and as Margaret says, complicated grief. Later on, they just service up and they are depressed. They have anxiety. They have all these issues. They don't want to get pregnant again, and it can be a very, very complicated. So counseling is part of that package of that loss. Number two, just to clarify, when you're talking about postpartum depression, you're talking of a delivery. And a delivery, you're talking of a pregnancy that is viable.
Okay.
Yeah, in our setup, you're talking about from 28 weeks. That's about 7 months. That's when you can consider to have a viable baby. So when you're talking about postpartum depression, is after a delivery.
Okay.
When you have delivered a baby. The rest are just pregnancy losses, abortions.
Yeah.
And then those ones are in the category of abortions, and therefore they should undergo counseling as a pregnancy loss in that aspect. Yes.
Call us live in studio now. Our call is open. It's on 0708 756396. That's 0708 756396. Kindly also make sure your volume of your television is low, and let us know where it is you're calling us from. We're looking forward to be answering all your questions. Are there any disorders with people that can be misinterpreted as postpartum?
Because you're talking about mood disorders, you're also talking about the depressive disorders. If I like the way Dr. has put it, it's postpartum because there is delivery.
Okay.
So if we remove the postpartum and we have the psychosis and we have the depression, then there are disorders that share similar symptoms.
Okay.
The only breaking point in this case is there's a delivery. So like it's easy to find someone with bipolar 1 manifesting major depressive episode, sort of the same symptoms like the ones we have talked about.
Okay.
It's easy to have someone who has a major depressive disorder, what most people prefer to call clinical depression, manifesting the same symptoms. So in mental illness, the breaking point will usually be one or two symptoms, or also the triggers surrounding it. So there are those that can easily be mistaken. Yes, or they share. There's a similarity in the symptoms.
Okay.
Yeah.
Let's get to the call line. James from Ruaraka. Hello. Good evening.
Hello, good evening. How are you?
Fine, thank you. Thank you for watching Health Check. What is your question, sir?
My question pertains blood pressure. We've been discussing mostly about postpartum preeclampsia, that's
Yes.
high blood pressure.
Uh-huh.
I wanted Dr. to mention something about low blood pressure because my wife is around 20, from 22, 23, 24 weeks, her pressure was low.
Uh-huh.
What causes that and the dangers pertaining that?
Okay. Thank you
Yes.
so much for watching, and he is going to respond shortly.
Most welcome. Thank you.
Awesome. If people are taking advantage of this free consulting, it's fine. We're here for you. That's what we're here to do. 0708756396 is our call line. You can go ahead and answer that question
Okay.
and also comment on the same.
Yeah, thank you. Most of the pregnant mothers have low blood pressure, and it is not an abnormality. It is really a physiological change in pregnancy because of the hormone progesterone. What that hormone does is to expand the blood vessels so that the blood kind of travels slowly in the body, and that is physiological, so that the most of the blood can go into the uterus and serve the baby. So you find most of the mothers will have a pressure of 100 and over 70, 90 over 50. That is normal, and that is why most of the mothers have some sort of headaches. It doesn't need any treatment. All what they need is to make sure they are well hydrated, they're taking enough water, and also to rest.
Okay.
Maybe some mild painkillers here and there. Otherwise, it's a normal physiological change in pregnancy.
I want to give him a thumbs up for being so supportive in his pregnancy. I mean, he has the details, the
Yes.
weeks and everything. Role model in society. Awesome. As we continue, you had a comment on the same question of the other perinatal disorders.
Yes, yeah, thank you. Margaret has talked so well about the psychological issues. There are other medical conditions that can be confused, and thyroid disease is a major differential diagnosis
Okay.
of postpartum depression, especially hypothyroidism. The low functioning of the thyroid gland is just right ahead, right on our necks here, the hormones, the thyroid hormones. That's one of the tests that we do check. We also need to think of other diseases like diabetes, hypertension. They can actually show up
During this time?
During this time. We also have, some growth in the brain that can affect our mentation, and they can be confused with postpartum depression. Some, mothers will look quite slow. They'll complain of headaches. They're not happy. They're just low. They'll cry excessively and all those kind of things. So we need to look at other conditions, comorbidities that can come with pregnancy and be confused with postpartum depression.
Okay, we're continuing with your calls. Dorcas from Car West, we're continue with your call. You can go ahead and call in as we answer these few questions that you've been sending in on 22232. Keep sending them in on 22232. Let me just get that. And as well on our Facebook, thank you so much for your comments. As I load and as I get to that, what happens if a patient fails to get treatment?
When you're talking about mood disorders and then you're talking about the depressive disorders, let me go a little bit back and say that the way our body is wired to have a balance, a good equilibrium at any one point. So when you're talking about postpartum and you're talking about depression, then two things could either be happening. One, there is an overproduction of certain neurotransmitters, and there is an underproduction or an underfiring of certain neurotransmitters. So when either of them is happening, then it creates this state of imbalance. So if there is an overproduction, for example, of a neurotransmitter, then that basically will mean this individual is severely, highly stimulated. So if you do not get treated, then you're likely to get into a manic phase.
Margaret, can I just pause you there and pick another question, but don't lose your train of thought, tafadhali. George in Moranga, good evening.
Good evening to you.
Yes, sir. Thank you so much for watching Hope TV.
Yeah.
Go ahead and ask your question.
I have a question. My question is, can the diet of an expectant mother,
Yes, sir.
can the diet of an expectant mother affect the health of a child, maybe if he or she has been conceived?
Okay, did you get the question?
The diet.
The diet of a pregnant mother.
Yeah, so that it can affect the baby.
Yes.
Yes, it can.
Okay.
Yeah. And mothers, we encourage them to have at least a nutritional assessment, and to be advised, because if the mother has good nutritional habits, balanced diet, then it will get healthy baby, and that has an implication even in the future performance of the baby, the brain development and all. So we encourage the mothers to have a balanced diet, because it has an effect on the growth and even subsequent performance of the baby, of the child.
Wow.
Yeah.
So I used to hear when I was young, mothers need to eat a lot of fish so that your child can grow with smart brains. Is it true?
Sort of balanced diet.
Okay. Let's keep it a balanced diet, meaning
proteins, a bit of carbohydrates, vegetables, and a good amount of water.
Yeah.
So
my director is saying omena. No comment. Anyway, as
so one of them.
Okay, that's fine. We'll continue picking your questions like that. But you are actually talking about.
Okay, so if this balance is not maintained, and you develop a mental illness when you don't have that balance, because either some hormones are not being produced in the right quantities, not neurotransmitters in the right quantities, or there is an overcharge, an overfiring. So what is likely to happen in this particular case? Because remember the mother with postpartum depression, and let's include the father as well, Dr. because they also suffer postpartum depression. So if they don't get treatment, they can easily get into a psychotic phase over a long period of time. Alternatively, they can get into a major depression, and they get now the major depressive disorder, which now will be a bit more, it will take more time for them to snap out of it, to get out of it. And that is why immediate intervention is important. And if they're not getting the medication from the psychiatrist, and they're not getting psychotherapy support, remember that trigger is still present. So it's like you're exposed in this environment, and you're living in this environment, and the exposure just grows and continues to grow and grow. So eventually what happened? Your system will get overwhelmed.
Oh no.
Yes.
Question, when you said let's talk about the fathers, can the father get the depression and the mother doesn't?
Yes.
Okay, so either of the partners can suffer. Okay, that's interesting. What are those telltale signs in the men? Are they the same?
Yeah, they're the same.
So the man is sad.
Yes, can cry excessively with no good reason. They're not interested with their friends. They don't want to talk to them. The joints that they used to go, they cannot go. If they were playing golf or they liked watching movies, they're no longer interested. Low appetite. They cannot sleep well.
They're not trying to engage. There's no daddy time, skin time with the baby.
They have no interest at all. They just want to be left alone. Yes.
So watch out for that family. Sure,
And,
go ahead.
and you know, when they are when they're suffering this, the loss of interest, they can't sleep and everything else, then they're most likely going to end up looking for a psychological painkiller, which in most cases is going to be alcohol or some other substance. Yes.
Wow.
Yes.
So let's watch out for the same as family members, as close support. Watch out for these signs and symptoms that we have said, and some of them just to check, and if I'm getting them correct, you guys can just say, good job, Kerry. There's a change in mood. It's almost manic because you're extremely sad, extremely withdrawn, do not want to hear, the baby crying or those kind of things. You're not sleeping when you could be sleeping. When the baby is sleeping, this is a good time perhaps for you to take a nap, but you're up and you're just thinking a lot. You're saying things like, if I go away, you'll be able to raise these children. Things that they're saying as well. Those are some of the things that I got as well. My first encounter with postpartum depression, I was just watching the TV. I think I was 9 years old because we were in that house when I was 9. So I'm just putting together everything. And this lady said that she was looking at the baby and wanted to throw the baby. So immediately someone came to visit. She put the baby on the chair and she ran. And she was just running for her life. What would you'll comment on that. But Leo from Narok. Good evening, Leo.
Fine.
Hi, Leo.
Yes.
Karibu sana and thank you for watching Hope TV.
Yes.
Sure, go ahead with your question.
My question is, good evening to you.
Good evening.
Good evening to you, Leo.
Yeah, I have a question to doctor.
Yes.
My child is 2 weeks old, and she cries very much when it approaches around 9. Now, we have tried to give her dry water, and up to 80 times a day, but it is not materializing. When we try to check the temperature, she's normal. She's suckling well. What might be the problem?
Okay.
But after 1 hour, she comes to normal.
Okay, Leo. That question has been taken in. The doctor will respond right now. Thank you for calling.
Thank you.
Wow, this show is a bomb. The men are the ones who call. Ladies.
Where are you? Okay, Leo. Okay, that's a good question for a pediatrician, but I'll assist Leo by saying that babies tend to cry a lot, and especially at night. Grape water is not advised, so they should stop giving grape water. It's normally given once in a while when they think that the baby is not passing wind, gas. But you're advised after a feed to lift up the baby and kind of bump the baby. That is more advised than the grape water. If the crying is excessive, it can be a sign of a problem. Maybe there's an issue with the food system or something.
Colic?
Yes, colic and such. So they should see a pediatrician just to make sure that there is nothing else, and it's just the usual crying of a baby. Otherwise, babies are known to cry. It's not going to be for a long time, so they should not get the postpartum depression because of the excessive crying. It is something that you're going to go away. But for their comfort, it's good for them to see a pediatrician just to make sure that there are no other underlying problems. But babies to cry is one of them.
But he is highlighting it's 9.
Yes. Yeah, it's not really timed.
Okay.
But basically at night is when the babies start to cry a lot, and during the day they sleep.
Okay.
Yeah.
So Leo, your baby girl will be fine. Go ahead and see a pediatrician in case there are any other underlying issues that may come up with the same.
Yes.
Did I cut anyone short before the calls? Okay, fine. We're still receiving your calls live in studio. Our call line is 0708 7563 96. Go ahead and call us right now live in studio. We're also taking in your text questions on text line. Our text line is 22232. We'll be responding to them back to back as we proceed one by one with our doctors in studio. Even as we're talking about getting your husband to go to counseling during this season. Daktari, I think it starts with you.
Yes.
and I think they can listen more. Then now they can go to.
Yes, if we start there.
Yes, absolutely. I know sometimes it's difficult to get the daddies to go and see the counselors. I know it's not easy because they will always play tough and say, I'm okay. I'm okay. You're the one who had the baby, so me, I'm fine. And that time they are saying like that, they are the ones who are already suffering the depression in the first place. But let me say, it all starts during the antenatal period.
Okay.
And during the antenatal period is a very, very important time that us as caregivers fail to bring in the father, the husband, so that they get to understand, what is it that my wife is going through. And also for them to be made to understand that there are issues that can happen. Because during this time is when you tell the mothers, this can go wrong, this is what is going to happen, your labor will be like this, when you're delivering you might get a cut, which again affects the women when they get a cut during delivery. There's things like placenta previa, abruptio placenta, there can be preeclampsia, there can be all sorts of things. Because if one is forewarned, then already they are forearmed, so that when these things come up, they'll be more able to tolerate. And the husband will become part of the team. This is now the support system that you're trying to build in. And when you now bring in the couple, then even at home, the bigger children, you'll be brought on board. So that when it comes now to issues, unfortunately, if the postpartum depression comes in, the fathers are more adaptive.
Okay.
But what do we find these days? I mean, you find the fathers are nowhere. Some of the daddies, we even drop the mothers at the parking. They are left in the parking, enjoying some music, reading some newspaper. They give the money, the card. The mother comes back. Oh, you're done? Okay.
Let's go.
Let's go. That's not a very good thing, because what will happen is when they are now needed to be part of the issue, they'll not be there.
Okay.
So we encourage the father right from the beginning to understand the pregnancy, the issues. They go for Lamaze classes together, the perinatal the prenatal classes, and they try to understand all these things. So when issues come, then they'll be more informed.
They'll be forearmed.
Yes.
Calling from Francis. Good evening. Hello, Francis.
Yes,
Hello, thank you for calling Hope TV. How are you?
I'm fine.
Sure, go ahead and ask your question.
I am Franklin.
Yes.
Evening.
Good evening.
Good evening to you.
Good evening.
I would like to ask, my stomach has a problem. When I eat something, it starts expanding more to an extension of not eating again. Even when I stay for about 10 minutes, it starts becoming too hard. And I went to hospital. I was tested with some amoeba. Hello?
Yes, sir.
And I took those medicines.
Okay.
Now, when I eat something, I start
Yes.
feeling so bad.
Okay.
And it's so expansible.
Okay.
Yes.
Okay, so I will respond to that. Thank you so much, Francis, for calling. Thank God that our doctor had to go through med school before specializing, so he will have a response to that. But today we are talking about postpartum depression, which is a mood disorder in couples and people who have had a child. And this happens right after and slightly before and throughout this season. So that's what we're talking about. But please help Francis.
Yes, so I think it was Franklin.
Franklin, yeah.
Yes, you need to see a GIT specialist, a gastrointestinal specialist. I from your history, I think you may need to have probably an endoscopy, even a colonoscopy, so that they find, is there an issue? How come when you eat some little food, your tummy just balloons? Is there, is it any gas? Is there some bit of obstruction? So they'll need some assessments. I'm not advise Franklin to see a gastrointestinal specialist, physician. They'll be able to do some scans, some endoscopy, and you'll be sorted out.
That is good. Yes, is it that painful one that they do something that goes through your whole?
Yes,
yes. The injection?
The injection, they put something through the mouth and down, and then they get
something
to see
else
what
through
is
somewhere
happening.
else, and they clear so that they see. Okay. We are going to pick a caller from Narok, and we have some texts. Hello, good evening. Thank you for calling.
Yeah.
Yes, who are we talking to and where are you calling us from?
Leo.
Yes.
From Narok still.
Yes.
I do hear. Yeah, how are you?
Yes, can you reduce the volume of your TV, tafadhali?
Yeah.
Okay, sure. Go ahead with your question.
Now, I do hear there is a formula of getting a baby boy. And how do we go about it? Or it is godly given?
Okay, yeah, but that's the first one we need to pray, but we'll ask Daktari right now. Thank you for calling.
Okay, Leo, there's no formula to say the truth. Many things are said, or many things. Some of them don't make sense. Others have no scientific basis. But and I always say, and we always say that as reproductive health specialists, that you can either get a boy or a girl. There's nothing in between. There are no other several sexes. So there's no really format. There's no formula that you're going to get a certain sex. Of course, there is sex determination, which is very, very complicated, which involves like in IVF setup, where you can look at the egg that has something called a bar body and be able to decide which sex. But again, those are very, very complicated, and they're just trial things. So there's no way to say that you're going to get a boy or a girl.
Okay, a question to you, Margaret. How can someone take care of a relative who's going through depression? Maybe sister, wife, brother. Sometimes it is very hard. What is your advice?
One of the things, and thanks for that question, one of the things that you can do, let's look at it two ways. We have the lady going through postpartum, and then we have the caregiver. So one of the things that you can do with the lady going through postpartum depression is please try and get off some of the responsibilities of her shoulder. Remember, one of her struggles is sleep and rest. And because we talk about exhaustion is not just physical, it's mental. And the moment they know, lethargy is not physical, it's mental and it's emotional. So the moment they know they have a good support system around them, that works, does a lot towards getting them a bit emotionally stable and just finding comfort in that support system. It's very sad for the new mothers around this time because we can't go to visit them. And because of that emotional instability around this time, then there's a likelihood of them feeling like they've been abandoned and neglected. They have to take care of themselves. They have to take care of their family. Probably someone doesn't even have a nanny to help them. And they have to just make sure that the house is running. So those people around a new mother, please just try and take a bit of those responsibilities off their shoulders. Mind the older children. Just make sure she has the right help that she needs at this particular time. Get someone to go do shopping for her. That's what I like about our grandmothers. I mean, you had one to come and fetch water, bring firewood, do all these things, cook, bring you cooked food. So you didn't have to think about those things because they were well taken care of. Then when we think about the caregivers, like we said earlier, there's compassion fatigue. Caregivers also get very tired of taking care, especially people with mood disorders or any mental illnesses for that case. The caregivers need time out to also go and recoup and get a bit of their me time. So bring in a third party now. So that when you're not there for half a day or something, then someone else is stepping in because you also need that time out. the caregiver needs some form of exercises just to get whatever it is that they are dealing with and to spend the energy in a positive way. Caregivers must take care of themselves, so they must practice self-care in order for them to take care of the other person. Otherwise, if you're a caregiver who is not practicing self-care, then you're not worth and you're not good enough for the other.
And you can even burn out.
You'll get a burnout, yes, that's the thing. So they also need that.
Okay.
There are instances where we also bring on board the caregivers for therapy because it's emotionally draining. Living with a mother who is having postpartum, it's not funny. It's not easy. It's very draining emotionally and also weighs you down. So caregivers also need someone else to take care of them. And we also recommend it's okay for them to go and seek therapy so that they can also be taken care of.
That's amazing. Well, we'll be coming to you for your wrap-up. But Dr. how do you wrap up?
Okay. Postpartum depression, what I would want people to understand is a treatable condition. So we should not neglect it. We shouldn't say like that's a final deal, it's a done deal for those mothers. We need to take care of them because it's just for a time and they'll be well. And if we do what we have discussed in this program, we involve the correct support system, then you move on to the clinical psychologist, then you move to the doctors, the psychiatrists, and all of us team up. We are going to help those mothers and you have a healthy family.
Dr. how can people reach out to you just for anything within this time?
Okay, I'm available. My phone number is 0722-764545, and I'm in Savannah Medical Center in Upper Hill. And they can be able to get me through that number, which is open 24 hours.
That number is so easy. If I get arrested, it's a personal card. 0722-764545.
Yes. It's an easy number.
Thank you so much, though. We appreciate your time.
Thank you.
What I would like to tell the viewer is what they need most, more than anything else, is your love, is your understanding, it's your ability to communicate care, and just to know it can be anyone. You know the hashtag, it could be you.
It could be you.
Yes, so anyone can get there, and they need your support in order for them to spring back. And like Dr. says, the prognosis is good, the outcome is good. They get out of it and they live normal lives. The flip side of it is if they don't get that, then we are also not just talking about ill health for the mother, but also we are also talking about negative outcome for the child.
Yes.
So if we need healthy children, then we need to take care of the mother. Yes.
Someone would like to reach out to you and just hear your voice all day, just consult with you. How can you get in touch?
You can reach me on 0716 875-896. Yes.
Awesome. Someone says, thank you so much for answering my question. I appreciate. They'll follow up on that. And someone who said we should pray for them. They need their marriage restored. In Jesus' mighty name, I really believe that God is going to work in it in this season and in this time. Can you just speak a blessing to them? Because they're watching, they just need hope.
The Lord is faithful.
The Lord is faithful.
He is.
Let them trust to be well.
Yeah.
Yes.
Awesome. It's been great. We're going to leave you with a first aid video that just to keep you abreast with what you can do to support everyone that's around you, courtesy of St. John's and our team right here. Thank you so much for watching Health Check. Today, postpartum depression, a conversation that is hush-hush, a conversation that not many people have. Ladies, it is okay. You can be treated and it is fine to go through this season. It could be hormonal changes that are happening in your body. It could be your environment. It really is not you, but we can take care of you. So just step out and be confident in the situation. Go through the motions, go through the phases, get treatment, because it will affect that child in the future. From me and our amazing team right here, it is good night. Have an amazing evening. See you next week. Go ahead and follow us on Facebook at Hope TV Kenya. We are on YouTube and all the episodes of Health Check are on there, so you can catch up. Thank you for watching. From me, Kerry Kagiri, it is have a beautiful, beautiful evening and see you soon, and enjoy this first aid clip. Thank you so much.
Thank you.
I appreciate you so much for coming.
Thank you.
Once you notice that your casualty is bleeding from the nose, what you're going to do, you're going to advise your casualty, please pinch the nose. You see, the soft part of the nose. I'm going to pinch the soft part of the nose. Remember, I'm still wearing my gloves. So I'm going to pinch the soft part of the nose, and then you ask her, are you able to do this? If you're able to do this, please do the same thing as this. So pinch the soft part of the nose. Once she pinches the soft part of the nose, what I'm going to tell her is to lean slightly forward, and then I'm going to tell her, keep pinching the soft part of the nose and try and breathe through your mouth. Try and breathe through your mouth to ease breathing, and then I'm going to observe her for 10 minutes. She's going to do that for 10 minutes. Then after 10 minutes, I can tell her to release it. Try and release it. If it has cleared up, I'm going to get some lukewarm water and wipe around the affected area. But if it has not cleared up, I'm going to tell her to continue pinching her nose for another 10 minutes. And then after the second set of 10 minutes, she releases her nose, and then I observe again. Is she still bleeding? If she's not, I clean up with lukewarm water and then tell her to rest. But if she is still bleeding, she is going to pinch for another set of 10 minutes. So a maximum of 30 minutes. So if after 30 minutes your casualty is still bleeding, she needs to go to hospital. Okay? So do that. If after 30 minutes she has stopped bleeding, then you may not need to go to hospital. Just keep observing your casualty. If it starts up again, then you may need now to go to hospital. Okay, so that is how you're going to manage nose bleeding. Now remember, there are things we should avoid doing. We've heard about guys telling you that you need to tilt your head back. Now, if she tilts her head back and she's nose bleeding, what happens is that the blood now runs down the throat. If it starts running down the throat, it can easily induce vomiting. If she vomits in this position, what would happen? She can easily choke. So do not tilt the head back if the casualty is nose bleeding. So just lean her forward. And also when the bleeding stops, she should try not to blow her nose. Also try and not maybe speak too much, because that may disturb the clotting process. So just observe, sit quietly, and wait for the casualty to get or to recover.